Well, here I am, and I'm pointing to my stomach to demonstrate abdominal squeezes, which is not difficult, as I mentioned. Squeeze on exhalation, activate transverse abdominis. Big diaphragmatic yogi breath on inhale, and you've got that patient started with an easy exercise that helps their digestion, and they feel like they've accomplished something. So if they're willing to do that, and they usually are, I ask if they want to try the next step in their own recovery based on how they feel. And I will say, go ahead and bend your knees and we'll practice pelvic tilts, which is the most powerful low back exercise. And I'm assuming everybody in the audience knows what this is, but it's just rolling so your back is flat and then tilting so the curve of your back is off the mat, and go as far as you can within your comfort zone. And ideally, you exhale on flat and inhale as you arch your back. Not difficult. And again, if the patient's willing to do 5 or 10, I say, great, you're started. You'll improve your digestion, your willpower, drain any excess swelling through your lymph. And then for those people that are willing to go to the next step and upgrade after that, I say, well, you can actually walk in bed and keep yourself fit without ever getting out of bed. I've worked with the best athletes in the world, and we keep them fit even though they're laying flat on their back. So can you just maybe move your arms up and down in a big exaggerated motion like a kid would when they're walking? As far as you can, swing your arms comfortably. And then try and march your legs separately. Lift them as little or as far as you can. The goal is to make it a big walking motion, like I'm demonstrating here, where your heels will rest on the floor after each stride. So after they're able to do that, I give them an explanation of that. When we first learn movement as humans, our first movement is crawling, which is an opposites motion, which we develop as adults into walking. Thus, Peter Gosku calls it cross-crawling. In this case, I want you to get into an opposites motion because this motion is hardwired in us neurologically, and it will translate real effectively to walking when you're ready to walk. So after they've done a few of the legs and they know how to rest their legs after each tap, I get them into an opposite position. You can see here my left knee is up, my right hand is up as far as I can take them comfortably. Then I pause and I say, hey, just keep doing opposites. And it looks like this. Most patients get it after a few moments or even a minute or two, and they automatically know it's activating their abdominals. They're getting good inhalation, exhalation through their lungs. They're activating their heart, which works 4 times as much with any upper body activity as any lower body activity. And it's a great place to start the bed program for that bedbound patient who doesn't want to do anything else. So if they're willing to do the next step, and I do have athletes that work this way up to the number 1 ab exercise for runners, I say just lift your heels off the ground. And I call that back air walking. And that looks like this. Again, it's not a difficult upgrade, and the patient usually gets it right away. But the stress on their abdominals goes up tenfold. The heart rate and the cardio work also increases dramatically. And people that are bedbound can't do this for very long or at all. But if they're willing to, they can stay fit and not get out of bed. And I've used this on athletes with great effect. And if it is an athlete, they want to go to the next level, I just say do back air walking, which is air running, which is just increase the tempo of your back air walking. So this is back air running. And then if they're willing to increase to the next level, I say you want to do the number 1 ab exercise for runners. You just lift your shoulders off the mat. And if you can add a little normal counter rotation, because when we walk or run, the upper body rotates opposite of the lower half. So you add a little of that, and you've got the number 1 ab exercise for runners. And that all looks like this. Now, clearly, your cancer patient isn't going to do this, but I need you as a therapist to understand, don't limit your cancer patient. I do this. Nobody thought I'd be able to, and neither. Sometimes your cancer patient is willing to do the next thing. And now you have these tools to upgrade anyone who is bedbound, whether they have a cancer diagnosis or not. So good job, and we'll say goodbye to that exercise.